you, Elizabeth. I am going to layer in some information into what Elizabeth shared. My name is Dr. Corinne Smorra, and I am the Chief Clinical Officer of Heart and Mind Counseling. I specialize in congenital heart disease in private practice for the patients and their loved ones. So one of the things we want to take a look at is the impact on CHD on the siblings. So when we take a look as time goes on and you all have gotten the child home and things are adjusting, we see that some of the siblings experience some issues, such as social contacts and psychological difficulties. So siblings of children with chronic illness do have more psychosocial difficulties and a lot lower quality of life than those whose siblings are healthy. And I'm not saying that this is going to happen to every sibling, but these are some things to just be aware of as you're trying to manage everything that's going on in your family unit. One of the other things is you get decreased parental attention and increased parental expectations. And as we can see here, Anna Mae was pretty straightforward at discussing that she did notice, she and her sister noticed some differences there. But as they have a warm, close relationship, they are able to manage those feelings around it. One of the things is partial transfer of responsibility of the child with CHD. So what does that mean? That means sometimes the sibling will feel that they have some responsibility in terms of taking care of the child with CHD to help the parents out. And then we'll have conflicts of emotions these siblings will experience. There'll be loyalty to the CHD sibling, but then they will also experience anger, jealousy, or guilt. Another one is reduced participation in society along with the stigma. So your CHD sibling may have reduced participation with friend groups, being able to do outings, being able to do some things because the family unit is concerned about what's going on with the CHD child, and perhaps they're having a surgery or some sort of intervention at that time. And then the stigma that they may experience because people have questions or they're unsure, they don't know. So that becomes attached. Research also shows these siblings are afflicted with moderate to high stress, which makes sense because they do have concerns about the well-being of their sibling, along with other pressures they're experiencing. Some of the information I've read too is that the siblings will also get concerned that they will have an issue with their heart going forward, or they will have some kind of chronic issue because they're seeing it happening to their sibling. One of the things is these issues do not go away as the child with CHD ages. The siblings feel responsibility regarding their care once the parents can no longer take care of the sibling who has CHD. So what I'm referring to here is as the parents get older and the child with CHD ages and the siblings age, the siblings start wondering, well, who's going to take care of our sibling who has CHD when our parents can no longer? Are we going to have to provide for them? Are we going to have to help them out with employment or housing? All those kinds of situations, these siblings do feel a sense of responsibility. So one of the things that can happen is to be able to make plans for that and understand that. Also, siblings do experience adverse life changes, and these can impact school performance, their behavior, their quality, will predict lower levels for a harmonious relationship. This will help the sibling understand the child who has CHD will not get away with poor behavior due to their disease. This is pretty important because we want to make sure that the child who has CHD is not taking advantage or utilizing the extra attention they get to their advantage when it comes to the dynamics of the relationship in the family. A lot of times, a child with CHD will come home from the hospital and all of a sudden they're not getting all the attention that they're used to receiving, and they have to transition into functioning in the normal family unit. And this is really important to pay attention to in order to keep that warmth and closeness among the siblings. One of the interesting things too that people don't realize is there is an interdependence which can develop in the relationship between siblings. So the sibling with CHD may rely on the other siblings for what I quote as physical support. However, the sibling will rely on the sibling who has CHD for emotional support. So you have to recognize that when something is occurring and the sibling with CHD is experiencing some issues or interventions or health issues, the sibling that does not have CHD will be emotionally impacted because that sibling provides them a lot of emotional support. The other thing is siblings recognize there is differential treatment. So the differences between the siblings can actually help create harmony. So acknowledging the differences can foster closeness and decrease sibling rivalry. What does that mean? So if you have the sibling that has the normal functioning heart, if you accentuate the things that they do in terms of their hobbies and interests, and then you accentuate the different hobbies and interests that a child with CHD has, maybe the CHD child is more into crafts and creativity, as the sibling that doesn't have CHD might be more into mechanical things or building things. Highlighting that can create actually closeness. One of the other things we want to discuss again is parents can address with the siblings their plan with the child with CHD for long term if they are no longer able to care for them. That can help alleviate some of the stress off of the siblings as time goes on and everyone ages. So with that, I am going to turn this over to Alyssa Geis.